After almost 2 years of reporting daily COVID numbers, the state health department announcing a big change now. The health department is going to shift from reporting daily to weekly. That's going to start next month. David Caltabiano is live in the studio with more on this. David.
Yet not everybody is happy with this decision. In a blog post, Dr. Richard Carmona says daily reporting requires a lot of work and time from hospitals and state health officials. The post was endorsed by major hospital systems, including Banner Health, the largest in the state. Though a Valley doctor I spoke with disagrees and is calling for transparency. He says he feels this move is merely sweeping COVID under the rug. Cases, hospitalizations, deaths among the key COVID data points Arizonans looked at on a daily basis for years is switching to weekly. Jessica Rigler, the assistant director of the state health department, says the change will give a more accurate representation.
In fact, when I look at the dashboard, I will typically just toggle to see the weekly view because the daily numbers fluctuate so much. It's difficult to kind of get a good trend analysis from that.
Rigler says the change eliminates some of the data variability they have due to labs around the state reporting at different times and when testing centers are open.
So, for example, if we've got a backlog in reporting from a particular lab and they report extra cases, multiple days worth of cases on one day, we'll see a huge spike in new cases. And then we can often see some concern among the public that there have been, thousands of cases reported on one day, when in fact those cases actually occurred maybe a week, 2 weeks, 3 weeks ago. So it's not really a great accurate representation of what's going on.
But Valley doctor Sam Durrani disagrees.
We've been dealing with that for 2 years. I mean, the reporting lags have been present in far worse numbers. Actually, the reporting's gotten a lot better.
Dr. Durrani says he uses the data to prepare for upcoming surgeries and make decisions about surgery schedules based on those numbers.
We look at the daily numbers, the physicians in the hospitals look at the daily numbers to see what's going to happen because it's predictable from the state daily numbers how many patients we're going to see in the hospitals.
Moreover, Dr. Durrani says the people of Arizona deserve transparency with daily, not weekly numbers, especially those who are immunocompromised and watch the metrics closely. Arizona's family asked Rigler about people in those situations.
A couple of things I would say. One is that we would still encourage people to take reasonable and responsible behaviors to protect themselves from COVID-19. We're not out of the woods yet. Even if data switches to weekly reporting, we'll still have that sense of what's going on generally in the community as far as transmission levels go.
The Post also says the Association of State and Territorial Health Officials indicates at least 34 states no longer report virus data daily. The last daily data count is on the 26th. It'll then move to weekly on March 2nd, Jared.
Got it, David.